All right. Hello, everybody. Today's a super exciting day for me because I get to introduce all of you to Dr. Rebecca Sutphin. You can call her Dr. Rebecca, and we're so excited that she's joining our practice officially the first week in January, but you'll see her around the office mid-December, getting to know all of you. And so I thought this would be a really good opportunity, since she's not with us yet, to give you a little teaser and kind of get to know her. She is great. She and I met 5 years ago at least at a dry needling certification, Dr. Fishkin's dry needling certification, which yeah. And I think before that too, I don't know, our circles have crossed and crossed and crossed, and the stars aligned, and we were able to convince her to come work with us at Gard. So she's joining us as the latest associate, and we couldn't be happier. So for the next however long we spend chatting, we want you guys to get to know Dr. Rebecca. So I'll kick it off with a question. First, welcome and thank you for joining us. We're super pumped if you haven't picked that up already.
Thank you for having me. I'm so excited. Yay.
Yay! So tell everybody, like, how'd you get to where you are? Tell us your story. How'd you find acupuncture? I'll give you a loaded question right off the bat.
Yeah, absolutely. So I grew up in the area. I'm a Raleigh native, so been close to this area, and I I guess I'll kind of my background. I'm a doctor of chiropractic, and while in chiropractic school, I got my training and certifications in acupuncture there. So it was all in one. I went to school at Logan University in St. Louis. So went from Raleigh to St. Louis and then moved back to the South because it was being in blizzard areas was not for me. So I was happy to move back to North Carolina. But yeah, got set up, moved to the area about 2017, and then I got set up in practice in 2018. But originally, I kind of came to chiropractic. Um, I had different professions before that. So I got my master's in forensic anthropology. I went to NC State, so I originally wanted to study bones, like the TV show. So I would do excavations, so archaeology excavations, and study if there were any remains, study the skeletons, and also work with police, law enforcement for forensic cases. My advisor had done that. So originally, my plan was to focus my master's on that and get a PhD and work and be a professor in that realm. And that was about in 2011, and the economy was still a bit downwards, and I couldn't really find a job right off the bat in forensics, and I needed a break after my master's. I was kind of burnt out. So I started working in the manufacturing world at Burt's Bees in RTP. And it was a really great experience, and it was good to kind of get out of the forensics for a little bit. And then I realized that maybe forensics wasn't the right fit, even though it was fascinating and good work. I realized how I kind of depleted my energy a lot. So I was new manufacturing. It was a good opportunity, but it just didn't feel like the right fit at the time. And I was curious about health and science, but not knowing how it would fit exactly into my career. So just was kind of working in that realm. And then I was riding my bicycle and I was hit by a car and was pretty banged up, but no major injuries. So had pain meds, muscle relaxers, kind of standard care, just getting checked out at the hospital. And was kind of in a tough spot. And my mom was like, well, go see my chiropractor. And I was like, well, really? And she's like, no, really, she'll set you straight and you'll feel much better. So I went to a local doc in Raleigh at the time, and literally she adjusted me and the pain went away. And I was just like, what is this? It's amazing. So I was so fascinated by it, and it was just kind of fit all the different interests that I have. It was a holistic care, very gentle approach for trying to let the body heal on its own. So I quit my job and went to school, and I had been curious about acupuncture, but I hadn't gotten treatment for acupuncture as of that point. So while in chiropractic school in St. Louis, it was a high stress environment, and I had been prone to getting migraines and headaches more often. And so I was able to go to an acupuncture clinic while in St. Louis and noticed an immediate improvement in the intensity and then the frequency of my headaches and migraines. And they went, not completely went away, but they went away pretty fast. And I noticed that tightness in my jaw and any TMJ issues that went away pretty quickly. And I just would have to monitor it and every once in a while get a little tune up. But that, in addition to some of my PMS symptoms, really improved. So, cramping, bloating issues with my menstrual cycle had a lot of improvement with that. And just changing just one thing into the care. And I was just so fascinated by the concept of traditional Chinese medicine and how it could link in with the chiropractic. So I did both, studying both in school. So it was a lot, but I loved learning both. And then my plan had always been to combine the two in practice when I graduated. So that's what I did.
I love that. It's so interesting. So many people come to this profession, chiropractic and acupuncture, on the heels of their own personal journey. It's heard to be said so many times that the profession kind of chooses you. So I love to hear that. And
Absolutely.
also second career, corporate
Yeah.
America, slow death, and here we are. So you see lots of clients in practice. Who do you love to work with? What do you love? What do you love to treat? And I know that it treats
Yeah.
lots of things, but
Oh,
what
yeah,
lights you up?
absolutely. I, well, just being a chiropractor, the nature of things is that you can immediately help with neck pain, any type of back pain, shoulder or hip. But because I personally experienced a lot of like the headache, migraine, jaw tightness, I do love offering that. And I do cater a lot to folks that need that support. So if you're open to needling, right, that can be a big benefit and you can see results pretty quickly. Maybe not instantly, but within a couple of sessions, normally can get some improvement. So I really enjoy helping folks that are suffering with that. And then I also really like doing ear acupuncture. So, auricular acupuncture is another term for auricle ear. And it's interesting, there's certain points in the ear that conceptually you treat body organs. So think of like your ear as you're in the fetal position, but it's reversed. So it's like the lobe is like head, and then you're looped around, and your hips and legs kind of carrying through here, and your inner organs are kind of in the belly central part in the little hole, like the concha area is what they call it. So you can treat different areas of like the back on the ridge of your ear, and then literally like headache points, you can massage or do acupuncture in the lobe region. But there's a lot of points that help with kind of mental emotional state as well. In Chinese medicine, they approach emotions and how what you're experiencing a little differently. So there's points on the body, but also a lot on the ears that really help support the mental state. Like, we're not treating any, there's no diagnosis, no official treatment of any mental disorders, mental um, issues per se, but it takes stress levels down. It's pretty instant calming. It helps with vagus nerve stimulation, so calming your nervous system. So, what really excites me is that someone that might be stressed out, a bit anxious, has a lot of stuff going on, maybe some pain points, how it can both help the physical but also the mental emotional. So if I can offer that to anyone that's say like stressed out mom or anyone then maybe like perimenopause, there's lots of hormone changes going on and we can just kind of calm that down. So it can be helpful to anyone at any age, but especially with maybe hormone fluctuations or pain points and just this, our stress levels are rising so much now with just the state of society. So that is a really effective way to just kind of calm things down so you can go about your day. So yeah, it's the whole body holistic approach. So that was a long-winded
No,
explanation of what I do,
it
but
was perfect. No, it was perfect. It was a very
yeah.
wide question. We have started at Gard to include at least monthly acupuncture into treatment plans for that very reason, for overall body balance, but mostly stress management, because we are all kind of living in a stress soup. And all of the things we can do to move us from our sympathetic nervous system to our parasympathetic and calm the nervous system are the things that we want to offer, because we know that health and vitality is on the other side of that. So you will all, new patients will get to meet Dr. Rebecca for those balancing visits. We do get a lot of patients that are coming for, probably most commonly looking for fertility support. Headaches are very common, like you said, stress, relaxation, and these are all things that you have experience with. So I'm so excited to bring you on board. I'm going to hit you with kind of the most common questions that I usually get for a new patient that's on the acupuncture table. Number one, and I'll let you answer them. Number one, does it hurt?
Oftentimes, it every once in a while, there might be a little zippy sensation or a little discomfort, a little bit of ache, but oftentimes it's very relaxing. Most people are surprised that I've already put 3 needles in by the time like realizing, oh, I didn't even feel anything. So 9 times out of 10, it is more of a relaxing experience and people can fall asleep on the table. It's just very calming. But if you have active pain, if you're inflamed in an area, it can be a bit more tender. It can be a little zippy. And there is, because of the nature with the needle, there can be a bruise every once in a while. So it might be slightly tender, but it's all temporary. It's just a little temporary discomfort to get lasting results. So if you can kind of sit through it and breathe and focus and try to relax, often some discomfort will generally last for 30 seconds or a minute and then it usually calms down. So it's just kind of knowing that a little bit ahead of time, and I'll talk you through everything and we'll do breathing together. And then if there is a needle that really is uncomfortable, then you can always take it out. Like no one has to suffer through it. It's very manageable. So we
Absolutely.
can navigate all of that together.
Yes, I love that. And Dr. Rebecca, you'll meet her. She has, you have such a just a calm energy that I can't imagine anyone would be stressed out for long with those questions in treatment.
Thank
Let's see,
you.
what else? How long is a session?
So the appointment times are 45 minutes. So that gives us time to have you come inside of the office space, the room, check in with you, see how everything's doing. Are the pain points still currently active? And I also like to ask a couple just quick questions to see how your digestive health is doing, how your sleep is, because that's important in the Chinese medicine aspect too. If you've been sleeping poorly lately, then I might want to throw in a few different points to acupuncture. Or like, let's say if you have any different organ issues, then I hone in on that because, kind of going back to Chinese medicine, the acupuncture, they call them the meridians or the channels. The different points, they kind of, I'm showing my pointer finger. The large intestine meridian, it starts along the point of the hand and then it runs up and it ends by the nostril. So it's not physically over the actual organ point, but they think that needling along the point of the organ meridian or channel, it can influence and support the large intestine. So let's say you're going to have a colonoscopy in a little bit and you're not sure what's going on, then I'm like, okay, we're going to needle some large intestine points, right? So, anything like that, there's anything different going on with you, with your health, or just, if you're feeling anxious or stressed out, then I take that into consideration too, and I might tweak and change a few points if that makes sense. So,
Love that.
so that it's the 45-minute period. I check in with you about what's going on, and then the needles will stay in for about 30 minutes. That's typically the time frame, and then take them out and make sure you're feeling okay, and then you're off on your way.
Love that. How do you think most people feel after their kind of first treatment or subsequent treatments? What's the most common thing you hear for people coming off the table?
Most common is that people just feel relaxed. Some people can be sleepy and you might need to rest or take a little break. 9 times out of 10, people are more relaxed, and you just need to make sure to hydrate, have like some decent protein like during the day to support yourself, and try to get a good night's sleep for afterwards. But yeah, it's a relaxing experience. If it's the first time you've ever done it, you might feel a little wiped out, but usually after the second or the third time, you'll bounce back much more quickly, and then just start to feel more balanced and supported. Like it's a good energy boost. Every once in a while, there's some people that get like an energy spike and they feel like they can run a marathon and they're like, woo! But that's like the low percentage, but every once in a while that'll happen. So if you're like, woo, then don't freak out. That's everyone's slightly different in their response, but usually most people feel more relaxed, more calm.
That's great. And true, depending also on how your energy comes in that day, our energy is different every single time, every single day, every single
Mhm.
moment. You might have a different experience, I would imagine, from one treatment to another.
Absolutely. Yes.
Yeah. I I'm trying to think of the most common questions I've had for new acupuncture patients, but I think probably does it hurt is the most common one. And people kind of have this
Mhm.
vision that we're taking these needles that are huge, like the needles you would get with an injection or something at the doctor's office that's they're jamming it into your thigh and it's really going to hurt. And that's just so not the case at all. Um, well, Dr. Rebecca, thank you so much for taking this time. Oh, she'll be in the office mid-December, getting to know all of you, and then full schedule starting January 5th, the week. Am I
Yes.
correct on that?
Full
I believe it is. Yes,
schedule.
we will
Yes.
have her. Yes, we'll have her schedule live online very shortly, and we're so excited to have her join us, and we're excited for you guys all to meet her too.
Bye. Thank you, Dr. Leah.